and start the recording and hand it over to Stacy.
All right. Okay. Well, hi, everybody. Thank you so much for joining at this odd time. This odd time was to accommodate me. I'll tell you why in a second, but I really appreciate everybody coming together tonight, today, this morning, wherever you're joining from, and talking about digital health advocacy. And I think it was Tanya who asked, what is digital health advocacy? And I think that there's going to be a lot of different answers to that tonight. My goal tonight is really just to provide about a 20,000 foot view as to some of the things that I've become involved with. And then we can, as a group, gauge further interest to further engage in some activities. And like I said, we can decide that as we go along. But anyhow, I'm Stacy Hurt. Yes, I'm Apple, and I'm coming to you from Pittsburgh, PA. So, all right. Now, how do I advance slides? There we go. Might be
I think it's your Apple device that's causing the problem.
Oh, too soon. Too soon. Ouch, man. And as you can see about me, I'm very casual. If you have a question, please feel free to jump in, interrupt me, drop it in the chat, whatever you feel comfortable with. But anyhow, that blonde woman right there on the left is me 1,000 years ago. And I was in pharmaceutical sales. So I want to start I'm kind of new to the group, but I want to start with a brief introduction of me, who I am, etc. So here I am 1,000 years ago with blonde hair as a pharmaceutical rep for GlaxoSmithKline. So my career started in healthcare in various roles, physician practice management, which encompassed sales, marketing, operations. I worked side by side with doctors, and you have not lived until you've chased down a doctor for a diagnosis code to get him or her paid. I'll tell you, those are some uncomfortable conversations, but those are the types of things that I was involved with. And I was also, a lot of that was training on Medic system, which turned into MISIS. So I was training on a billing system, which turned into an EMR. And so I did a lot in digital health when I was in physician practice management and pharmaceuticals. And then a couple things happened. Number one, my older son, Griffin, came along in 2003, and this is my younger son, Emmett. He was born in 2005 with a very rare chromosome disorder. He has, for our genetics experts in the crowd, he has a 1q duplication. So anything on number one is extremely rare. His Q duplication is on the end, 41 to 43. His karyotype is one of 3 known cases in the world. There is in the literature, there's a girl in England, a boy in Italy, and Emmett. So even with advanced health degrees, I have an MHA and an MBA. My husband has an MBA. We worked in healthcare, and we are still to this day, Emmett's 15, we're making it up as we go along. Emmett does not walk, talk, or do anything for himself. He functions at a 6-month level. He doesn't sign, he doesn't point. We figure out what he wants and needs by crying and going through a series of elimination, just like a baby. He's 90 pounds, he's a full lift. So I'm lifting him several times a day. And he is my full-time job. And he is why we had to gather tonight at 7, because I care for him during the day. So I am a full-time caregiver in every sense of the word. Like I said, feeding to mouth, nebulizer, several medications. Emmett's completely dependent on me and my husband for his life. We did have a nurse helping, but she's been out because of COVID and a foot injury. So it's been an extremely long 15 months, but Emmett's a total blessing. And I've told this story 1,000 times, and he's made me a better person, and I wouldn't have it any other way. Emmett's part of who I am, and I'm so blessed and proud to be his mother. So, okay. Then when you thought, oh yeah, Stacy really has her hands full, in 2014, I was diagnosed with stage 4 colorectal cancer, and I had symptoms of bleeding, fatigue, pain. I've been a lifelong athlete, a non-smoker, a really fit individual. So stage 4 colon cancer was the last thing anybody ever expected. And thankfully, I was in the shape that I was in, or else I wouldn't be alive. So I had an 11-centimeter tumor in my rectum, mets to my liver, lungs, lymph nodes, 27 places in my body. When I asked the oncologist what my chances were, he said he wouldn't answer me. He said, I don't have a crystal ball. You all have the same story. I'm not telling you anything that you haven't heard. But I am glad to say that I just hit 5 years cancer-free in October. And you all in this crowd will appreciate that I am classified as an exceptional responder in the literature. And we could go through a bunch of reasons of why. But again, I am blessed and lucky to be alive. I thank God every day that I'm here to talk to you, to be here, and to be Emmett's mom. So I'm truly honored to speak to you today. So Stacy, where are you now? So I did work during my treatment, but because I had this sort of unique trait, these unique skill set of working in healthcare and now being on the caregiver side and the patient side, I was like, there's something to this, there's something to this that I can offer the world. So advocacy is part of what I do. This is my friend Jim. He passed away in 2019 from colon cancer. So I do a bunch of volunteer advocacy like you all do. Patients find me on the internet. I try to help them the best I can. I have a website with things that I did that were successful in my treatment. But what I really classify myself as is a patient consultant. And so again, it's using the skills that I used when I was working in industry and have translated them to helping companies, pharma, biotech, industry understand the patient voice and what we as patients face, and helping them be more patient-centric. So this was me pre-COVID when we had a normal world, speaking on stage. I can't even remember what that was like. And I get to do cool stuff, be in Times Square, and meet Phil Mickelson, now the oldest player to win a major. And so I got to meet him as part of my advocacy work through the Cologuard Classic a couple months ago. You might have seen it on TV. But anyhow, I was out of my mind yesterday rooting for Phil. I was bawling. It was a whole thing. It just anytime, and you all can appreciate this, when you witness history and you weren't supposed to be alive to do it, it gets you. So, yeah. All right. Well, I believe in, first of all, saying what I'm not before I'm saying what I am. So let me tell you all the things that Stacy Hurt is not. And I will read these just for sake of people that are multitasking or who are visually impaired. What I'm not is a researcher, an informaticist, an economist, an academic, a biostatistician, someone well-versed on clinical trials because I wasn't in one, someone well-versed on policy, I never worked in the public sector, or a clinician. So you'll never see me on a white paper. You'll never see me in the PanCan world. You'll never see me presenting at AACR. That's just not who I am. I value all of you in our group who are in that world and who have PhDs and who do that work. That's not me. I'm comfortable with that. I'm secure with that. And like I said, I am appreciative for the work that you do in the research academic world. So what am I? Well, if you haven't figured it out in these first couple minutes, I am outspoken, a problem solver, a businesswoman, a connector, definitely a hype man, a motivator, a galvanizer, yes, a proud social media whore, and I am, Stacy's laughing, and I'm one of you. So what I want to say is that, yes, as my friend Lygia, who's our guest on the call today, called me today, I am a huge megaphone. Yes, I am. I embrace it. And in social media, so, oftentimes you see somebody on social media and you meet them, you're like, are they really that person? I am that person. What you see is what you get. I put it all out there. I say how I feel. I do back it up with data and with links and evidence-based approaches, but I own my opinions. I was known as Big Stace as I was battling cancer because I'm 5'11" and I have a big personality, but I will fight for you till the end. If I was me, I would want me on my side because I am dog loyal. I got your back. I will fight for you. And I'm not afraid to say how I feel. So that's what I am. What do I stand for? Again, I'll read these: accessibility, inclusion, which includes our friends in the LGBTQIA community. My son has severe intellectual and developmental disabilities, so I often use the hashtag IDD. He also has autism, so I stand for IDD and autism acceptance. I believe in reducing stigma, particularly when it comes to mental health. My own diagnosis of colorectal cancer has a lot of stigma attached, other cancers. I stand for affordability of healthcare, health equity, health literacy, getting vaccinated, including patients in product workflow design, for example, patient engagement, and compensating patients for time and expertise. I'm very vocal about that in social media. Coming from industry, when we compensated doctors and clinicians for their time and expertise, I do believe that this is an emerging field that we all can start to embrace in compensating patients. My affiliations, when I say affiliations, I mean, we all have a million. I think of affiliations as I could pick up the phone and call somebody and they would take my call and they know who I am and they know that I'm with them. So of course, our group, Colorectal Cancer Alliance, Fight Colorectal Cancer, Colon Cancer Coalition, Colon Town, Colon Cancer Foundation, and the Colon Club, Healthcare Business Women's Association, I just joined this year, Society to Improve Diagnosis in Medicine, CITM, Lifebulb, Clara Health, Snow Companies, Maricoy is a new one for me, We Go Health, Savvy Co-op, and I am a HIMSS Digital Changemaker, which I'm here to talk to you all about tonight. And as part of that, I was asked to join the Telemed Now advisory group. We hold tweet chats every first and third Wednesdays of the month. I think I had invited everyone to one we did on patient advocacy, but you're welcome to join anytime. Patients are always welcome to the Telemed Now tweet chats, and we'd love to have you. Our mission is to maintain telemedicine beyond the public health emergency as a mainstream to augment clinical care, in-person care. So I want to talk to you a little bit about just some big picture digital health themes that we talk about in the digital health space. And certainly in the Q&A, we can open it up. I have a pro with me tonight who will also take any questions on these themes. But yes, that's me in the middle. That's true patient centricity. So any product design should be designed with a patient in mind. And these include telehealth, interoperability, that's artificial intelligence and machine learning, remote patient monitoring, you probably hear referred to as RPM, patient experience, democratized data, which goes to the April 5th final, the Cures Act final rule, which was patients having access to their complete medical record, and social determinants of health. A lot of times you see the hashtag SDOH, that stands for social determinants of health. And what I don't have up here is another acronym. It's used a lot, PROs, patient reported outcomes. So like I said, again, 20,000 foot view, these are some of the themes we can talk about them. We can ask questions about them in a bit. All right, so diving into what is HIMSS? And this is one of those that I always mess up the acronym. HIMSS is the Healthcare Information and Management Systems Society. It's a global advisor and thought leader supporting the transformation of the health ecosystem through information and technology. HIMSS is huge. 100,000 individual members, 480 provider orgs, 470 nonprofit partners. And then I'm cut off, but let me go back. I can't see that number.
650 health service organizations.
Thank you. Thank you. Oh, your beautiful faces are covering that, which I don't mind a bit. But the vision of HIMSS is to realize the full health potential of every human everywhere. And the mission is to reform the global health ecosystem through the power of information and technology. I'll tell you my story about how I got into HIMSS in just a second, because it's a good story. So I was chosen as a HIMSS, what they call digital influencer. And that word, you know, it makes all of us real itchy. So they changed the name of the program to the HIMSS Digital Changemaker Community Overview, a hashtag that we used. And I don't know if we're going to continue to use it in 2021, but it was hashtag Be the Change. So it is about forging change through digital health and healthcare information technology. But so we have an advisor, his name is Michael Gaspar, and he oversees our program. And what he is aiming to set up is a way to contribute digital content through social media, through interviews, snackable content, social polling, speaking opportunities. But he's really aiming to create a community that reaches beyond this sort of, there's 10 of us in that digital change maker, but really opening it up to more people across the healthcare ecosystem with, you know, eclectic skill sets. And that includes patients. And again, this is what's so timely about, you know, me speaking to you. But the core principles, again, I don't want to go through this, but it's really to get, you know, trusted, diverse perspectives, give voice to the underserved, support the growth of each other. We're very supportive of each other in our group. Explore new collaboration opportunities, champion innovation, equity, and inclusion across engagements. Again, it's cut off. Hopefully you can see it. Okay, so, okay, there we go. Again, these are, so there are 1, 2, 3, 4, 5, what they call pillars, content pillars. Oh yeah, it says that right in the middle. 5 content pillars of what HIMSS stands for. And it's health equity, the patient journey, technology, the caregiver experience, and public policy. And so that's what, when we create content or we put content out there, it falls into one of these 5 buckets. Something that we started for this year, since last year changed everything, and I can go through that too, but we're starting to create these little snackable and content like blogs or video or whatever each one of us feels comfortable with around these social media observances. For example, I did a video for World Cancer Day. That was in February. I did a little video. A couple of us did videos around World Immunization Week. And then these are the ones that are coming up that are ongoing. So the big one on here that I want to point out is that the national conference for HIMSS is happening August 9th through the 13th. And what happened last year was the conference is typically in March. It was supposed to be in Orlando. And HIMSS was one of the first conferences to cancel as COVID ensued. It was controversial. It was tough. It was costly for a lot of different reasons. So they wanted to be really strategic around proceeding with HIMSS 21. They just made an announcement that they will require in-person attendees to be vaccinated. But one thing, if you do follow me on social media, you know that I am a big proponent of free or discounted patient advocate admission to conferences. So of course I asked Michael Gaspar, our leader, our advisor, I said, they're all going to ask me, is there free or discounted admission? So what I can tell you is that I am in talks with Michael to try to make something like this happen. Really, with the vaccination announcement, things are just starting to crystallize around HIMSS 21. So I don't have any information for you yet, but if or when I do, I will report back to you. You have my word on that about free or discounted patient advocate admission. I will let you know. And then HIMSS 21 also is going to be a combination of in-person and virtual content. I want to tell you that.
So Stace, I want to do two things. One, I want to just do a time check to make sure that people can have an opportunity to ask a lot of questions. Two, with what you were sharing on this last slide with the social media observances, is this all in Twitter, or should people be aware that HIMSS is using other platforms as well?
Yes, HIMSS is using all different platforms. They're across, and our guest, Lygia Ricciardi, whose face I just put up here, can correct me, but I know it's Twitter, Facebook, Instagram, and then
LinkedIn.
Thank you.
Clubhouse. No, I don't know, actually.
Clubhouse, for those of us who don't,
Clubhouse, those of us that are Android users.
Android.
TikTok. What about TikTok?
You know,
Not yet. The field is wide open there, unless you know otherwise.
Yeah. Go ahead, Rod.
That was a joke. That was a joke. That was a joke.
Yeah, you'll never see me on TikTok, that's for sure. I've aged out of that one. So real quick, I want to wrap it up here and open it up. Thank you, Stacy, for that. This is our Changemaker community, and how I did become a member was that the end of 2019, they did a call on Twitter. HIMSS did a call on Twitter for people who wanted to be these social media ambassadors, or what they were calling digital influencers. And I applied to the program because I felt really strongly that patients should be represented. And and I knew about HIMSS, having worked in physician practice management. I applied and was accepted. And so this is our group. A lot of you probably know Jen Horan Jeff, who runs Patient Savvy. She's the other person in the group who identifies as the patient. But this is a great opportunity for me to introduce our special guest, Lygia Ricciardi. Lygia really took me under her wing as a digital change maker. She was the first person that I wanted to set up calls with all the change makers, and she was my first call. She advises for Carium, and she invited me to do a webinar for Carium to share my experience as a patient for their top executives, and she compensated me for my time. Lygia spent 20 years in digital health, and she's very heavily involved in patient and consumer engagement. Lygia is a total champion for patients. She's been named among the most powerful and most influential women in health IT. She's been interviewed by all the major news outlets. She's worked in both the public and private sector. And so she's been a real mentor to me, and she's going to help us tonight and serve as a mentor to all of us as well. So that's it. Let me shut up. That was way more than I should have said.
No, that was wonderful. So first of all, Stacy, thank you for sharing your personal story. And I know that you do it a lot. And I also know that there's a vulnerability that you open up to every time you do that. So I just want to recognize that and say that personally, I appreciate it.
And might I add that Stacy and so I had followed Stacy, and all of you on here, you're my social media heroes. There's so many Twitter heroes in this group and on this call. But Stacy and I were actually going to have coffee at HIMSS. We had it all set up.
And they were like, COVID. And I'm like, no, it's really not going to be that bad. It's really not going to be. And then it starts to get really bad. And I'm like, no, but I'm going to meet Stacy. So there was tears. There was a sad moment, but we made good choices. HIMSS made good choices. I do want to open it up for anybody to ask questions to Stacy and Lygia. I want to thank you for being here and being open to also answering questions. Before we do that, I do want to address something that Tanya brought up kind of previous to introductions, and you may not have been here for that. But she asked a really pertinent question, which is, what the hell is, well, she didn't say that, but what is digital health? And the reality is it's a lot of things. And some people can look at it through the lens of getting healthcare through digital means, right? So we heard about telemed now and telemedicine. And so for some people, that is digital health. There is digital health advocacy, which is advocating for things like that. And then there's digital health advocacy, which is advocating for health things in the digital realm. And as far as I'm concerned, this group is so kind of well-versed and interested in both of those. So I would just invite people to throw up whatever questions they have, and we'll figure out how to answer them all.
Yeah, I'm searching the chat too.
I think the chat was mostly Stacy Love.
Oh,
Saying.
y'all are great. But
thank you, Stacy, for such a great description of who you are and then how you're doing your work. It's very impressive, all of it. Tell us about HIMSS. I've never been. I used to work at UCSF. We would send all the programmers to it, but never heard anything back from them about what happened there, and what would be our potential role, or what could we gain from going?
I might, I'm gonna be honest with you. I was too far down the totem pole in my physician practice management experience to attend HIMSS. So I've never been to HIMSS. So I am going to punt this one to my guest, Lygia Ricciardi, who can talk about what to expect at, so like I said, the HIMSS event itself, you know, there's that, but they're really making it, they're really trying to state that this is going to be like there's going to be a hybrid approach. There's going to be a lot of virtual events as well as the in-person approach. But Lygia, I'm sorry, go ahead.
No, not at all. Yeah, I've been to HIMSS a number of times in a variety of roles. It is massive. It is usually in Las Vegas. Only Las Vegas and like Orlando are big enough to actually handle it. So those are the only places it can be. I imagine it'll be different this year. Assuming all goes ahead as planned, Stacy and I are going to be there. We're actually going to be roommates. But for many people, honestly, I would say if there is an option to attend and do it virtually, that might make more sense. It all depends what you want to get out of it. I mean, I think it's obviously an opportunity to learn a lot from different sessions. There are tons of different presentations. You have to kind of map out your calendar way in advance. And by the way, Stacy, you may have things to add, other Stacy, about your experience at HIMSS too. But so there's a lot of learning, there's networking, but you have to sort of do your homework in advance if you're going to go to the physical HIMSS to figure out. A lot of people plan meetings with other people. So even though there's great content going on, a lot of the work gets done in meetings that you have with some corporation or group or healthcare provider organization that you really wanted to meet, because like all of them go to HIMSS. You set up meetings there. And then there's a lot of kind of happy hours and dinners and a lot of socializing there. But as I said, unless you have a defined targeted task, like I'm going to be on a panel presenting and I want to meet other people who are really interested in a particular thing, I think there's a lot of value potentially in the online version as well, because it doesn't involve, frankly, the cost and wear and tear of travel.
Yeah, I think that's sage advice, especially this year, which I think is bound to be a little bit weird, just because we're re-entering that kind of physical space again. But Meredith, you know, again, this is such a diverse audience that attends HIMSS. So there are a lot of people who are very interested in privacy and security, right? And so there are, I put a link to the program in there, but there are tracks, just like there are with ASCO and with AACR. There are people there who represent small companies that are looking for funding, and there are a lot of venture, capitalists there that want to hear, those pitches. There's a lot of leadership from large health organizations and looking for leading practices on how they can modify and improve the patient experience. And so pretty much if you were to spend some time with the program, you would probably find something that was interesting. That said, I will say that like most multifaceted audience conferences in the healthcare space, our voices, the advocate voices and the patient voices are still pretty rare. And so the benefit for you is, it could be grabbing information to understand the space better, or it could be using your outside voice to ask the hard questions, to raise the issues that sometimes these people in their own little kind of silos of moving forward don't consider. If it were me, and if this were like the first conference that you were thinking about going to on digital health, I would say it's not an ideal first conference. Actually, it's overwhelming, and you may feel a little bit like you can't pull value and you can't add value. That said, I do think the virtual option gives people a lot of opportunity, and I know Stacy's going to use her outside voice to get everybody in for reduced rates.
Well, I'm sure as heck trying, but yeah, I would.
We can help you with that, by the way.
Yeah,
the 120 of us.
I actually think that's important. Like, I don't think that it should be just Stacy's voice, or certainly, I mean, that's a request I've made, maybe not specifically with HIMSS, I'm not sure, but many conferences. But like, if this community can kind of be like, hey, we're interested, can patients, like, if you, and maybe even to allay concerns on the part of the organization, if you can show some real, affiliation with ACE or something like that could be very powerful in getting them to feel like this is something they should open up. Because I guess there's the value of HIMSS itself, but I think also if HIMSS does offer special opportunities to patient voices to be represented, it's more likely that others in the industry will as well.
And we can definitely do that. And Lantia, you recommended, offering or allaying their fears. And unfortunately, you're right. I don't know why people are afraid of including patients, because we were all like professionals and did other things before we were patients. But I think the other thing that we're able to do is talk about the value that we bring to the conference as a whole, but also to all of the other participants.
I think that's right. And sorry to just jump in. What I meant by that was a very specific thing, actually. And I was sort of drawing on a conversation the other Stacy Hurt and I were having. I think not necessarily that HIMSS is afraid of hearing from patients per se, although there may be participants there who are slightly not used to the patient voice or don't understand its value. But I don't think that's the main thing. I suspect that they are slightly afraid that, given that they're under economic strain, just like everybody else, it's like, okay, well, if we start opening this up and all of a sudden patients can get in free, what if, a quarter of the people who were going to pay suddenly say like, well, wait, I'm a patient of this sort or that sort. So that's what I was saying about, like, maybe you could offer some, or I'm thinking that might be one of their stumbling blocks. I don't know that for a fact at all. I'm just guessing if I were in their shoes.
So with that being said, would it be wrong then to approach them to ask?
No, not at all.
We're going to do that, Stephanie.
Not at all.
And anybody that wants to approach them as an individual, I fully support that. But this
community, well, I wasn't really sure. Yeah. Okay.
Yeah. No, real quick. I wanted to, like I said at the outset of this presentation, my goal tonight, I just want to gauge interest. And then also, I'd like to sort of get with you, Stacy, Lygia, we could kind of one off and get a poll together and really gauge interest. How many, ACE participants are interested in HIMSS, and let's get interest, and then we can move forward as a group to sort of, leverage our voice to maybe influence them for a discount, et cetera. But I just really tonight, I want to gauge interest in digital health and things like that, and then take that back to HIMSS if that's okay with everybody as a sort of an action plan. Yeah.
Barbara has her hand up. She's very good at raising her hand.
I'm a professor at the university, so I try to set example for my students. So that's why I'm politely raising my hand. First, I wanted to say that you have to add something to what you are. You are a great presenter, and I love the way that you're. So this is my professor looking, and it looks so awesome. So if you can help with that, also my presentation and look better. And I just and I admire. In my school, I'm a dean of health professions, and we have a clinic for special kids. And today I was watching this parent take out his the kid with the wheelchair and put it, and I was there sitting, and I said, I admire so much parents, because we as parents protest because kids feel something or is having a tantrum like my used to have. But then, you know, the love that you have to have for, you know, what you do, and you can see in the picture, I just admire that. I wanted to ask you, what have you seen you have been able to, how your voice has changed the way HIMSS and this group you participate in has been affected? And the second question will be, like I mentioned at the beginning, or maybe I didn't, I'm always saying about it. One of my advocacy work is on disparities, especially for Latinos, the lack of consideration for Latinos, the language, and other things. So what can you say about those two things? And thank you for
great
the
question. So the biggest impact that I feel that I've had, number one, has been in telehealth, and definitely voicing the fact that patients need telehealth to remain as an option. I don't think that the powers that be had any idea how much patients, how difficult we have it, and how much we need options in our care for all the different things that we deal with getting through the pain or the side effects or this or that. Or as patients, especially, you know, in underserved communities, and transportation barriers, food deserts, no access to broadband. I don't think they had any idea what patients were facing until they heard it from us. And I think we have really opened some major eyes in the telehealth arena in terms of the need for telehealth to remain. They had no idea the problems that everybody faces in all the different communities and challenges, you know, that we face. So we definitely made traction there.
And if I can interrupt just a second, talking about telehealth, and also it's great, but be aware that it even for some communities is a challenge as well. A friend of mine is a psychiatrist here in Puerto Rico, and he was doing telehealth for her patients, and she's a child psychiatrist. And she could say she will struggle with some parents that they didn't have great internet or whatever in order to do that service, and the different that it has been. So, you know, it is another thing to have into consideration, that we might think everybody has a smartphone, but not necessarily be able to communicate these things. So I'm sorry for the interruption. I just wanted to add that.
No, thank you. And that's another point to health literacy, you know, that you know, that's an element of health literacy. And then when I speak to these tech companies and I show them, I have a slide from Startup Health that shows that the greatest investment last year was in patient empowerment tools, but the least investment was in education. And that shows the huge gap in health literacy. We have all these shiny tools. Nobody knows how to use them because there's no perceived ROI in education. And that pisses me off. I'm sorry. But, you know, and those are the things that, you know, and then health literacy in all of its forms that need to exist, you know, for accessibility. Oh my gosh, I could go nuts. But anyhow, okay.
Stacy, with that being said, you know, I live in a community that is considered rural in Eastern North Carolina. And, you know, COVID has been great to the fact that it has allowed patients that didn't have transportation to be able to have that visit at home. But on the flip side of that, it has actually increased the canceled appointments for treatment because the patients can't get there. They can't have those telehealth because guess what? They don't have a smartphone. And their internet they have no internet. So these kids were going to school with broadband on a school bus parked in an area where they could go to get their homework done during school. So just imagine that cancer patient that doesn't have that flip phone. And I'm aware of that because I'm asking people to do a survey to support a cause that I'm passionate about, but I'm having to have a paper copy because those people don't have the internet or the smartphone or capability to get online. But those are the people that I'm after, or those that are not here tonight, those that are out there that would like to be here but can't be. And then I have to print out those surveys for them to take and actually read it to a lady, because guess what? She can't read.
Right.
So, you know, it is, I applaud everybody that is trying to make that part of health disparities, you know, better. But they're in all of our communities. We just have to open up our eyes and see. And those are the people that I want to hear what they have to say, but they're silent.
That's you nailed it. And I see Stacy commenting, you completely nailed it. That's just it. I mean, the people that we're trying to reach, it's like the chicken and the egg. We can't reach them because they don't have what they need to be reached. And how do we make that happen? And that's why I fight for, I'm like, you can't be a health system asking patients to access a patient portal for appointments and test results when you're not providing internet access to them. That's BS. I'll be nice. That's crap. You know, you got to be a stakeholder in this. If you require these patients to access these, you know, EMR or patient portals for information, then you better, you know, provide the means for them to do it. See, I'm fired up. I'm sorry.
You go, girl. I'm with you.
Well, again, this gets back to the what I am slide.
Well, I mean, it is. I mean, and I'm that way too. You know, don't expect them to do it if they don't have the tools to do it.
So Stephanie,
Amen.
you just brought up, I mean, you just articulated the crux of why it's really important, whether it's HIMSS, whether it's another conference, why it's really important to have patient voices and representatives of patient voices in the room. And so I would also like to highlight that even if you don't go to a conference physically or even virtually, the conversations are taking place. They're taking place on Twitter, they're taking place on Facebook, they're probably taking place on Clubhouse, but I wouldn't know about that. And this is another way that we can get involved. And I realize it's more cumbersome to do it as a thread of tweets, but it's possible. And you grab the attention of one person who's a decision maker or one person who's an influencer, and this is how we start to drive change. So I do want to do a time check because I want to respect that it's getting kind of late on the East Coast. Does anybody else have any questions for Stacy or for Legia related to?
You can email us. I mean, I know we're running up to time, but like I said, we're going to circle back. I'm going to send a follow-up email. I mean, with my slides, we're going to, you know, put a poll together, gauge interest. This is just one in a series of conversations in bringing patients into HIMSS. So, you know, Meredith, I'm with Stacy. I would not advise attending live, but we're going to find ways to get patients involved with, you know, through content creation, but we're going to get our voices heard in this group because this group needs heard through HIMSS.
And I just want to address, I know that some of you have talked about Twitter and some of you are not as comfortable on Twitter and some of you might not even be on Twitter. And so that's something else that we can address with this group is trying to get, you know, up everybody's level of comfortability with the health platforms, the digital platforms that they want to be comfortable with. And kind of help you guys engage in some of these conversations. Awesome. Thank you, Stacy. Thank you, Legia, for joining. Thank all of you for attending.